RA team, we have a tricky case on our hands. The patient presents with symptoms of tertiary peritonitis, metalysis, and enteritis. Let's brainstorm and figure out the diagnosis.
Could it be sepsis due to tertiary peritonitis or maybe some sort of metal poisoning from metalysis?
I'm leaning towards some form of gastrointestinal infection causing the enteritis. Maybe it's a combination of these factors.
I think we should consider a rare immune deficiency disorder like ZAP70 deficiency. It could present with these symptoms.
That's a long shot, Randall. I still think it's more conventional, like sepsis or poisoning.
Enough. I've made my diagnosis.
It's ZAP70 deficiency. We cannot waste any time. The patient needs immediate hemicorporectomy.
But sir, that's an incredibly risky procedure. Are you sure?
I'm sure. It's our only shot at saving the patient. Now scrub in, all of you. We don't have a minute to lose. Tracy, thanks for calling me in. I wanted to discuss the case of my patient with suspected ZAP70 deficiency. I believe a hemicorporectomy is the best course of action.
Hawks, are you sure about this? Hemicorporectomy is an extreme procedure.
I know what I'm doing, Tracy. I have years of experience, and I believe this is the right treatment.
I understand, Hawks, but we can't ignore your track record. You've been wrong before about similar cases.
Don't question my expertise, Tracy. I know what I'm doing. This patient needs this surgery.
I'm just trying to look out for the patient's best interest, Hawks. But let's not rush into anything without considering all options.
Fine, but I strongly believe in this course of action. I'll take a second look at the case, but I still think hemicorporectomy is the way to go.
Leslie, I just checked on the patient, and their condition is critical. We need to address this immediately.
Oh no, that's terrible to hear. What should we do?
I think we need to inform Hawks that the hemicorporectomy was not the right treatment for ZAP70 deficiency.
We have to be honest about this mistake.
But do you think Hawks will understand? I'm more worried about the patient and their well-being right now.
I understand your concern, Leslie, but we can't pretend this didn't happen. The patient's life is at stake, and we need to take responsibility.
What the hell were you all thinking? You almost killed our patient with your incompetence.
But, Dr. Hawks, the symptoms were indicative of severe hemorrhagic shock.
No, it was clearly a case of acute retroperitoneal hematoma.
I disagree. I believe it was an acute mesenteric ischemia.
Actually, I think it was an abdominal aortic aneurysm that we missed.
You're all a bunch of idiots. It was none of those. How could you make such a fatal mistake?
I'm sorry, Dr. Hawks. We will do better next time.
We will double. Check our diagnoses more thoroughly next time, I promise.
Yes, this was an oversight on our part. We will learn from this mistake.
I apologize, Dr. Hawks. We will be more vigilant in the future.
You better be. I can't believe I have to work with such imbeciles. I'm leaving before you all do any more damage. So, Johnson, how's everything going outside of work? You doing all right?
Well, you know, same old, same old. Just trying to juggle work and family. How about you, Hawks?
Honestly, I've been preoccupied with this puzzling case lately. It's been consuming all of my thoughts.
Oh, that sounds tough. You need to take a break and focus on yourself too, you know.
Wait a minute. I think I've got it. I know what's wrong with my patient. Sorry, Johnson, gotta run. I'll catch you later.
Wait, what? Hawks, where are you going? No goodbye, huh? Typical.
Sorry for barging in, but we have a serious case here. I need everyone's attention.
Hawks, what are you doing? You can't just waltz into the operating room without protective gear?
Yeah, not cool, Hawks. You're putting everyone at risk.
This is highly unprofessional, Hawks. You know better than this.
I can't believe this. Have you lost your mind, Hawks?
Listen, forget about ZAP70 deficiency. I'm certain this is pulmonary capillary hemangiomatosis.
Pulmonary capillary hemangiomatosis? What's the prognosis then, Hawks?
Is it treatable? What are we looking at here, Hawks?
Give it to us straight, Hawks. What's the prognosis for pulmonary capillary hemangiomatosis?
Prognosis is poor.
It's a rare and aggressive condition with a high mortality rate.
Tracy, I finally got it right. The patient's diagnosis is confirmed.
That's great news, Hawks. You did a good job in the end.
Yeah, well, if I didn't have such idiotic doctors around me, this whole mess could have been avoided.
What What do you mean by that? You were the one who initially diagnosed the patient incorrectly?
Well, maybe my diagnostics team should have caught it sooner.
Hawks, you can't just shift the blame like that. You made the wrong call.
I have important matters to attend to. Excuse me.